I want to introduce Marianne Laudio.
Laudio,
Okay.
yes.
Who we're very lucky to have as one of Dr. Sato's nurses working with the uveal melanoma program here. And she's going to talk to us a little bit about navigating clinical trials, and I think also hopefully have some time for questions and answers. And I'm sure other people can fill in too if people have some complex questions about clinical trials. So thank you for being here.
Oh, thank you. It's my pleasure. I just want to tell you how happy we are to be here for this event. This event is for you, and we're excited about this, and we're excited about everything that we can offer for you. Do you mind if I ask a show of hands of anyone who's participated in a clinical trial? Do we have? So we have a few, okay. And is there anyone who hasn't had metastasis yet? Okay, so it's a good group here. Okay, so my topic is navigating clinical trials, and I'm just going to skip through that one first. We'll come back. So I want to introduce you to the clinical research team. So basically we have the principal investigator who has the lead of this study. He might also be or she might also be the sponsor of the study. There might be a pharmaceutical study who has this particular protocol that we're doing, or it might be our local physician who has created this protocol and therefore is the sponsor. We have physician assistants, and nurse practitioners who are there to administer the treatment and help with evaluation of people who are participating in the study. And then we have the research nurse, research coordinator. If you're at a big institute, you've probably got more or less both a research coordinator and a research nurse, and your nurse might mainly function as a research nurse. Here, I'm basically a research nurse and a research coordinator. I do it all. I do have help. I have research coordinator. Yeah, I do research management too. So it's hard for me to separate out what you might experience somewhere else versus here. But the research nurse is really the conduit between you and the physician to introduce you to the study, to share with you what the purpose of the study is, what procedures are going to be happening, when you have to be here, when you don't have to be here, what your responsibilities are, as well as our responsibilities to you, and vice versa, to share with the physician what you've provided to us, what side effects you're experiencing, and what the doctor might need to know to really properly take care of the situation. We do have other people involved that you may or may not get any experience with. We have a regulatory specialist and data manager. I'll get to that in a little bit. So from the clinical aspect, we're interested in the health that you are presenting to us at baseline. So we want to know what your baseline health is. We're going to be giving you specific instructions about participating in the trial, and we're going to monitor your health and what's happening while you're on this trial. And we're going to follow up with you after the trial to make sure what's going on afterwards. So our regulatory people, they're providing and corresponding with the IRB and maybe the FDA, what's going on with the study. And we have data managers who actually collect the data that we are collecting so that we can actually produce results of this study and know exactly what's happening. So I just want to real quick introduce you to the phases of the studies. So a phase 1 study basically is a study that is the first time it's introduced to human beings. Previous research has been in a test tube or with animals, mice, whatever. With cancer studies, we don't give this phase 1 to healthy participants that you would do with other treatments. We give it to cancer patients. We're looking at the safety of the drug given at different doses with a phase 1 study. And predominantly, we want to know what dose can we give that is both safe and effective. And that's what we're going to take to our phase 2. We're going to study that dose that we found in our phase 1 study. We're also going to be learning more about our drug. In phase 1, we might not know very much at all. So we're going to be taking blood tests, and we're going to be studying what the drug does to your body and what your body does to the drug. You know, how fast is your body metabolizing the drug? Are there metabolites that are being produced in your body, or being freed in your body when it's metabolizing this drug, how fast you're getting rid of the drug, and how are you getting rid of it? Is it through your urine, or is it some other way, the liver? Anyway. So with the phase 1 study, you might have this escalating dose ladder, so that 3 patients, for example, the old way of doing it is 3 patients would go in at a basic minimal level of dose, and we would see how those 3 patients tolerate the treatment. We'd also be interested in how effective it is for them. But if they're tolerating the dose, at some point we're going to introduce another ladder of a higher dose, and we're going to give the next 3 patients this higher dose, which might be, I forget his name, but so it's like 100% times what we started out with, because we're starting out at a very low dose. And then as we go up the ladder, we're going to reduce how much more of the drug you're getting each time. But so the people in the second ladder would get a fairly good increase of treatment. We're looking for the dose-limiting toxicity. So we're looking for when we have a patient or 2 that are actually getting a side effect we don't like. And when we see that, we're going to jump back to the dose before that, and we're going to add more patients at that lower dose and see how they tolerate and if it's effective. So in the phase 1 study, it's generally open to many, many, many diseases. So multiple cancers could be treated in a phase 1 study. What that allows us to see is maybe there's a particular cancer that is more effective with this drug, or responsive to this drug, than others. So you may have a melanoma study. For example, we have a melanoma study that opened specifically for melanoma in a phase 2 study before they even finished their phase 1 study. So we didn't know the maximum tolerated dose, but they knew they were comfortable with 2 dose versions, and they jumped right into a phase 2. So a phase 2 is very similar to a phase 1 study. More patients will be put into a phase 2 study, and we're more interested in efficacy now. We want to know if it's working for these people. Phase 3 study is the final testing basically in patients. Hopefully you get to use your phase 3 results to go to FDA and look at getting this drug on the market. And we're looking for safety and effective. So we want to know now, does it work for a broad group of people? How many melanoma patients is responding to this treatment? Mostly it would be double-blind and probably randomized, and we're trying to avoid bias. Is everybody familiar with double-blind and randomized? No. Okay, yes and no. Okay, well, double-blind means that you don't know what treatment you're getting, and we don't know what treatment you're getting. In cancer, we generally don't use placebo. You might see the word placebo, and whether or not it really is will be dependent upon that protocol. Mostly, it's not a placebo. You're given standard of care treatment to compare this experimental treatment with. But you won't know if you're getting the standard of care treatment or if you're getting the experimental. We won't know which one you're getting also. That way, it avoids bias. We can find out, or the investigator can find out what treatment you're getting if necessary, if he needs to know in order to treat you. Randomized means it's a flip of the coin. It's basically a computer. We usually call in and we give them the basic information, and they will shoot back to us what your number is. Your number tells the pharmacist what drug you're getting, who's going to be preparing it, but they're the only person who will know what you're getting. Some other things that when you're writing a protocol, I know yesterday the topic was brought up about the monosomy 3 versus the class 2, and if you ever would not be eligible for a study because of that. More than likely, one of the things that would happen is we would stratify a study like that, because there's not going to be enough people with known monosomy 3, enough people with known class 2, and we would actually put them all into the same study, But up front, when we're randomizing you, we'd make a little stratification so the same number of people would get the same randomization of treatment for class 2 as opposed to the same number of people for the monosomy 3. That way we can actually compare if there's any difference between those two groups of people. We might find they're exactly the same and support what we think is going on. Okay, so basically, to make it a little more simple, phase 1, we want to know, is the drug safe in humans? What will the body do with this drug? How fast it metabolizes it, how long it stays in the blood, how does it get rid of it? And what will the drug do to the body? So what are the side effects of this particular drug? So in the preclinical, they do like 10 times the dose for mice because we're looking for what organ this drug is going to hurt so that we have a clue now when we're introducing it to people where the toxicity might be. But we're looking to really see if we're seeing it or not. And we also want to know, will it work or where it might work? In phase 2, we want to know if the drug is safe and there's a wider exposure in humans. And we want to know, will the drug work and what is its efficacy? In phase 3 is this drug really safe and does this drug really work? That's what we want to know. Phase 4, you're not going to really hear much about, but phase 4 is after it's on the market and you're getting it as a standard of care. There might be studies done that just how safe the drug really is when you have a broader exposure to people. So if you decide to participate in a clinical trial, you should understand the treatment being tested may or may not help you. You may get better, you may see no change, or you may get worse. Your participation helps the doctors learn more about the treatment being tested. The knowledge may help patients in the future. It may not help all the patients who are on the trial. Some trials offer experimental treatments that cannot receive outside the trial, and you may receive the treatment being tested, or you may receive the standard of care treatment. You will not know ahead of time which treatment you receive, maybe. But you may have benefit also. That was all pretty negative. Clinical trial pitfalls. So eligibility. I know there's a lot of questions there. People who have been around with the IPI for a while there, you might not be eligible for other studies if you'd had IPI. And now you might not be eligible for studies if you haven't had IPI. So it's like, how do you balance it? And it is a balancing act. It changes. It's like a wave. The ocean waves coming in. We got pretty stable waves coming in, and all of a sudden the storm comes and everything changes, and then it goes back. So eligibility. The important things are scheduling of your last treatment, whether you're timely to start a new study. If you've had previous chemotherapy, you might need 4 to 6 weeks for that chemotherapy to get out of your system before you can be introduced to another study. You might need 4 weeks if you've had a previous investigational agent to start a new study. A lot of that changes with the cancer studies, especially more recently. If you have progression and you actually need treatment, most of the times you can start treatment as long as there's not a really big reason that you shouldn't receive it. You're also going to need a target lesion. The only way that we have of knowing if the treatment works is having a target lesion. A target lesion, I'm sure you've probably heard, we'll always say, well, is it measurable? Measurable means we need a 1 centimeter lesion that we can identify on your imaging, that we're going to identify as a target lesion, and we're going to follow it every time we image you to see if you have response. If you've had treatment already, and that's going to be our target lesion, then that target lesion has to get bigger by 20%. So if you had a 1 centimeter lesion and you were treated for it, so that 1 centimeter lesion now has to be 1.1, did I get that right? No, 1.2 centimeters in order to go on the study. If you have illness at the time that you're considering a study, it might be an issue for the study if it's uncontrolled. Basically, controlled issues are not a problem. So things like congestive heart failure, chest pain, a heart attack within 3 months, those all can maybe exclude you from a study. Autoimmune disease, that's the one that's coming and going right now. Sometimes, even if you have a history of autoimmune disease, you're going to be excluded. Certainly if you have an active and you're looking for an immuno treatment, you will be excluded. Other cancer within 2 to 5 years, the gold standard used to be 5, and now some of the protocols are being written so that if you haven't had another cancer within 2 years, meaning that it's been properly treated and considered gone, you could be eligible. And then steroid therapy. So a lot of times if you have chronic use of steroid or high-dose steroid, it's going to exclude you from studies. Brain metastasis at the time is being excluded quite a bit, but not totally. If you have untreated brain mets, you're going to have to, most of the time you're going to have it treated, and it's going to have to be stable for a certain period of time. Sometimes they want you to be re-imaged 2 times to know that it is stable. So if it's uncontrolled, untreated, you will be not eligible. Or if you have leptomeningeo, so if it's cancer within the, what would you call that? The coating of the brain, that's always an exclusion. Medications might exclude you depending upon what you're taking, and we've already mentioned the steroids. So any medication that could interfere with the metabolism of this study drug, or this study drug might cause problems with the metabolism of the drug that you're taking. Those could either exclude you, or you might have to have an alternative medicine that you can take. The liver has several pathways that it uses to metabolize drugs. Some of those pathways are used with our study drugs and could cause a Sudan is one, for example, that we watch very carefully what you're taking and what your response is. There's also, I don't know if you've heard of QT prolongation. Sometimes when you hear about these people who are runners and they just fall over and have a heart attack and pass, a lot of times they think that that might be the QT prolongation, and with your electrical heart rate, your EKG, it's just drugs can cause this QT prolongation. So the FDA is very interested in any drugs that may be causing that and what your situation is. So blood work status, we always, well, everybody's used to getting blood work probably at this point. Certain out of ranges could keep you off study. So if your white blood cells are really, 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 really low, that could be an issue with starting a study. Same with the hemoglobin, platelets, liver enzymes, and your kidney function. ECOG, basically, to go in a study, most of the time you have to be able to take care of yourself and you're ambulatory. If you are able to work and care for yourself and you're active, 50% of the time that you're awake, you would mostly be eligible for study. But if you're confined to a bed or a chair, or 50% of your time you're really not taking care of yourself, someone else is taking care of you, you might be excluded from a fair amount of studies. If you had allergic, if you knew you had an allergy to any component of the treatment, if you're requiring a treatment for your cancer, of course, we're not going to know if the study drug's working or if it's this other treatment you have. So you'd have to get that other treatment and then come back and be considered for the study later. While you're on the study, you might be able to get some palliative treatment if it's not a target lesion, depending on the protocols. So, of course, if you're pregnant or breastfeeding, if you're unwilling to use birth control, and again, if you're a male, you also have to take consideration into that. Able to give consent and willing to abide by protocol requirements. You might need to provide a tumor specimen. You might have to have an archive specimen that we can send, or we might have to get a fresh specimen. So a lot of people have never been consented. And when we write a consent, we basically have a protocol. The protocol is our Bible. It's telling us what we're going to do, how we're going to do it, when we're going to do it, and how we're going to follow you. With that, we try to put it into lay term so that we can give you a document that you can take and you can read yourself, come up with any questions that you might have to come back with us for clarification, and to share with your family member or your doctor or whoever you would go to for advice, because we want, when you participate in a research study, we know that you're volunteering to participate, and we want you to be knowledgeable about what you're agreeing to participate in as much as possible. So, when should I consider a clinical trial? Most of the people in this room will always have a clinical trial that they need to consider because there is no standard of care. Here at Jefferson, we do have a lot of options that we're used to giving and treating, but generally out there, there is no standard of care for you, and you might end up only having a clinical trial to consider. Does it matter where you participate in a clinical trial? No, it doesn't matter where you participate. You should be comfortable with the consenting process. You should be comfortable with the institution that you're at, and you should be doing it totally voluntarily. You know, everything about it is you agreeing to do it, and you should be comfortable and doing it willingly. How can I handle the politics of choosing my treatment? I've had some people, so a lot of times it's a little difficult. Your local doctor may wonder why you're running off to Jefferson for this or that. Or even Jefferson, you know, we might get a little sensitive and say, well, why are you going there for that? We're not really going to say that, but we are sensitive. We can't get away from that one. So basically, I think everybody really is interested in your best alternative. And I know here in Jefferson, we will refer you out somewhere. And you just basically have to sit down with your doctor, you know, and you have to say, this is what I've researched. You know, I would like you to give this consideration. I would like you to talk to your fellow doctors or give this doctor a call and talk to him. I mean, if your doctor's not familiar with your situation and what your choices are, then you should be able to talk to them. And you can share the consent with them. That would help them. But basically, this is your life, this is your experience, and it should be your decision. And if it comes down to politics, I would go the route that I'm most comfortable with. And you listen to who your heart and your mind tells you to listen to. What is the advantage of a specific uveal melanoma study? Okay, so I've got studies to consider. And this study is only for uveal melanoma, but this study is a phase 1, and anybody's eligible for this study. Does that make one study stronger than the next? Yes and no. So a study we're doing specifically for uveal melanoma has had a little bit of background behind it. It has rationale, and there's a lot of reasoning why we're doing it. And we're only going to be doing it for uveal melanoma patients, so we're going to know how it's working for your particular disease set. But then again, phase 1 study, it might be a really novel compound. It might be something that we're all really excited about. We don't know as much about it, but scientifically, we're very, very, very interested. And that actually might tip it towards that way, because you might be your only opportunity to get in and try it. If it doesn't go to phase 2, you won't have that opportunity. So there's a lot of heavy decision-making, a lot of learning, and you just need to go out and talk to the people that you're comfortable with talking and gathering information. When do I need, so someone asked me about how do you know if you need systemic treatment or local treatment? And this is more specific to the uveal melanoma. With the liver metastasis, if you don't have metastasis outside of the liver, or if you have a little bit of maybe metastasis or even a little bit of metastasis, how do you know what the right thing to do is? And again, with that, you have to do your research. You have to consider what's important. The liver is a very important organ that you cannot live without. You might need to consider having your liver treated. You might be able to save that systemic treatment for a later date when you might have more systemic disease. There's just a whole lot of ifs, ands, and buts and considerations to take into account. But certainly, we believe that sometimes it's better to treat locally and save that systemic treatment for later. Okay, where to find clinical trial information? So if anybody's interested after all of that. So most of you I know many of you out there know much more about researching and going online and getting information because you do it all the time. So I'm letting you know that this is my effort to try and give you some information to get you started or to help you along the way. So clinicaltrials.gov, that's, let's see, I think I have, okay. So the FDA, with the Modernization Act of 1997, they are actually required to have a registry of clinical trials for both federal and privately funded treatments, experimental treatments for serious and life-threatening disease conditions. So the clinicaltrials.gov was created at that point, and it was expanded in 2007 to include even more studies. So basically, going back to clinicaltrials.gov should have everything. There's really hardly a study out there that shouldn't be on clinicaltrials.gov for treatment. A lot of the other places that you might go to, they're using the clinicaltrials.gov database and pulling it into their own and presenting it to you in a different way. So basically, clinicaltrials.gov is your base. The Melanoma Research Foundation has an excellent trial finder there, and I'll show you later. I'll get to that later. NCI also has the same thing, their own trial. They have a lot of additional information, too, about drugs themselves, what the drug is, and even terminology, so it certainly would send you that direction for anything. Okay, so I'm going to introduce you to clinicaltrials.gov first, and they basically have, so the basic search that you're going to do on clinicaltrials.gov is you're going to enter in a word or a phrase here and hit search. So you could do uveal melanoma metastasis, which I seem to always come up with first. But more popular is metastatic uveal melanoma, and you'll see where there's more options come up with that. But there's an advanced, okay, see down here, see the advanced search right there? Okay, if you click on advanced, you're going to get this page. This page allows you to specify more specifically what you want to look for, and I think some of the easiest ways, especially with what you've been presented with this weekend, you've gotten a list of some drugs that are really popular right now, targeted drugs. So under conditions, if you put uveal melanoma, and under interventions, if you put in MEK inhibitor, if you put in IGF-1R, you know, what is the drug type, you can put that in, and you can get, oops, let's see what you can get. Okay, so for a MEK inhibitor, there's one study open. So it tells you, it says found one study. It's recruiting temozolomide. It's a MEK inhibitor versus temozolomide. And it gives you the condition, which is intraocular melanoma, and the intervention, which is the two drugs. And you can manipulate this, which you'll see later. So if I go back to here, I can't go down, I guess that's everything. Study IDs, if you happen to know the clinical trials NCT number, you can put the NCT number there and jump right to your study really quick. If you want to check out Memorial Sloan Kettering, you can put in under sponsor collaborator, you can put in Memorial Sloan Kettering, and you can find out what all the trials that they have for it. Same with Jefferson. Or you can go in locations. Maybe you want to know where there's a study in close to you. So you can put in a state or a couple states around you in the country also. And you can also exclude your international countries if you want to by going this route. Because once you get into the big page, you got a lot of information. And if it's international and you're going back and forth a lot, I kind of save them and just do them just after the fact to see what's going on over there. You can do by gender, age, phase 1, phase 2, phase 3, all of them. You can do by how it's funded. You can do by safety issue, which most of our studies will all be, if an outcome has a safety issue, which is going to be all the studies you're looking at. so it won't really matter. And you can do it by when it was first received into the database or last updated. Okay, so this particular search that I did for metastatic uveal melanoma, I got 51 studies. It's not always helpful, but if can you see you can see the little print in red? So you can click on those and you can hide the studies that aren't open, and you can hide the studies that they don't know if they're open or not. But the display option that I have the arrow to, I'm going to show you right now. We've got the study, the condition, and the intervention. But these are, you can click on any one of these that you want, and you can get all of them, or you can have a couple. So the condition would give you the uveal melanoma. The intervention tells you what the drug is. The sponsor, you can get the sponsor collaborator. You can get, well, gender is not going to really apply. Age group is not really going to apply for any of us. You could put in the phase, what phase you want. How many patients are going to be enrolled into the study? That's per the protocol. It doesn't update it as how many are in the study. You can find out who it's funded by, study type, study design, the NCT numbers, anyway, it goes on. And I'm going to give you one that has all of them just so you can see. So our SERSphere study came up when you do uveal melanoma metastasis because I put it in. I got to go in and put in a search term as metastatic uveal melanoma, so it comes up for that one too. So anyway, you had the condition, stage 4 uveal melanoma, the intervention, it's a device, SERSpheres. The sponsors, Thomas Jefferson University, Dr. Sato and Dr. Gonzalez are the sponsor of the study. We take both male and female. We take adults and seniors. It's a phase 2 study. We're going to put 48 patients in the study. It's really not funded. We do get some support from the SERSpheres company, but it's not their study, and they are really not funding it. So the study type, it's interventional. It means it's going to treat. And the design, study design, you probably won't have a whole lot of use for this unless you do this a lot. So study design, there's endpoint classification. So we're looking at safety and we're looking at efficacy. And the interventional, it's a single group assignment, which means everybody knows what they're getting. There's no, we're not comparing it to anything else. And whether it's masking, that means masking says it's open. So that means everybody knows what they're getting. Going back to the single group, it means everybody's getting the same treatment. Primary purpose is treatment. There's the NCT number. We gave it a ID. It was first put in November 14th. Start date was in November. The completion date is estimated January 2015. It was last updated November 14th. And primary completion date, we got December 2003. 2013? Okay, sorry. And outcome measures, we're looking for the clinical benefit of this study in both previously treated patients and naive patients, patients who have never, that this is their very first treatment. Okay, and overall survival, progression-free, and duration response. And I'm running out of time, so just when you go in, you may not be getting everything, so you really have to learn how to make your way around this and use your terminology and make sure you have everything. So when you pull up a particular study, it's going to tell you who the contact person is for that study. So for this one, this is an MD Anderson study, and it gives you Dr. Patel's phone number. This is our study, and it gives you my phone number and my email. And this is a GlaxoSmithKline study, which normally they give you a phone number for GlaxoSmithKline. GlaxoSmithKline will never really show who their investigators are or give you contact numbers for them. You actually have to call them to get it. The Melanoma Research Foundation Trial Finder looks like this. So step 1, you're going to click off cancer treatment adults. You're going to choose melanoma. And step 3 is find a match. So from there, they're going to want you to create your own account, and you simply username, password. They want to know where you were born and what the name of your favorite pet is. And you're going to create a profile, and I ran out of time, and the profile is really long. So the profile is particular to you, to a patient, to a friend, to a relative, and they're going to show you how many trials you can consider. I got 323 matches for that particular profile. So you can see here the profile, who you can choose. You can have 10 different profiles, as many as you want. You put in the area that you want the treatment. And let's see. Okay, then NCI has theirs. So they're going to give you, they use the eye cancer intraocular melanoma. And they separate it out by all these different ciliary body, extraocular extension, except there's no difference between any of them, so I said all. You put in your location. You can do by zip code, NIH, hospital, institution, city, state, and let's see, just some of the others. You can go through and explore all of this yourself. Oh, this was just a list of the all the studies that are on there now for uveal melanoma, the type of study treatment there is. So you could use that, throw that into clinicaltrials.gov and see which drugs there are and which studies there are. That's it. I'm sorry it took so long.